Hi, I'm Wesley Walker of the New York Jets, former All-Pro wide receiver. You're watching Bridge to Health at Madhousetv.com.
Finally, the time has come. You no longer have to choose between conventional medicine and alternative medicine. Today, unlike years past, your team of doctors from all disciplines are working together side by side for the benefit of you, the patient, to help you regain your health and cross the bridge.
Hello again. Welcome back to the Bridge to Health. My name is Dr. Tom Dow. So I'd like you to check out this scenario. We have a football team. It's fourth quarter. 10 seconds left to play in the game. The team goes back in the huddle. The quarterback calls for red 34. That's the signal of the next play. The team gets on the line. The quarterback yells red 34. The wide receiver changes it, yells red 35. The left wide receiver changes that, yells blue 20, and the center says yellow 8. Hike! All of a sudden, quarterback gets the ball. Everybody's running different plays. Everybody's going in different directions. And guess what the result of that is? Disaster. It's very important that you as the patient have a team of doctors that coordinate your care so that they arrive at the proper diagnosis. They're all on the same, quote, page, and each one is communicating and talking to the other so that you, the patient, get the optimal result. And as you've seen in the paper and in the news many times in the past few weeks, everything is about protecting children from concussion who are playing football. We see articles and papers on special helmets they've now designed. We see teams spending $25,000, $30,000, $40,000 just on helmets. And the reason why is because concussion has been such a devastating injury, not only for the youth, but also for the college and professional players and its ramifications down the road. Today, we have the special privilege of having Dr. Ralph Mangels, who's going to speak about concussion with us today. Hi, Dr. Mangels.
Good
welcome.
Morning. How are you? Thank
you. Great having you here today.
Thank you.
So before we start, Dr. Mangels, let's hear a little bit about you. What's your specialty?
I'm a doctor of chiropractic, and within our field we have a subspecialty in neurology that looks at functional movement and dysfunction in the nervous system related to the spine, muscles, and joints.
And where did you go to school?
New York Chiropractic College, and I finished my postdoctorate degree at the Logan College of Chiropractic.
Okay. And what kind of work are you doing today? Where are you working? What kind of work are you doing?
Currently working for South Shore Neurologic for the past 20 years. We are an independent neurologically based practice. We have almost 12 neurologists on staff. I'm their house chiropractor. We have in-house PT and pain management.
So you're working hand in hand with neurologists every day. Are you doing any of their testing? Or what other kind of work are you doing?
South Shore Neurologic was probably one of the first groups to kind of come up in Suffolk County and start a vestibular head trauma center, particular vestibular therapy. Before it was considered...
What is vestibular therapy?
Vestibular therapy is a specialty that deals with balance disorders that can come from a number of different sources, from the brain, from neuropathy, which are diseases of the nerves, and as well as damage to the vestibular system, which is a mechanism in your ear that controls and gives us a sense of balance. And not too long ago, these therapies were really underutilized in the diagnosis and the treatment of it.
So if there's an elderly patient or any patient out there who has balance problems and they really don't know what this is being caused by, a neurologist, a chiropractor, or someone specializing in vestibular function would be a good person for them to see, right?
Correct.
And they would have special tests that they can do to assess where the balance problems are coming from.
Correct.
Okay, great. So we're going to talk about concussion today. What exactly is concussion?
Concussion has actually had a new look, primarily because of what happened with the NFL a couple of years ago. Unfortunately, football kind of brought it to light. There were a number of NFL football players that started exhibiting really abnormal behavior, memory loss, confusion, and their wives and their family members really took interest in this. And upon their passing, a few of the wives had donated their brains to a brain center where they were imaged and cross-sectioned, meaning they looked at them under a microscope. And over the years, they found, after having a number of brains, that there was a common pattern when they looked at these brains in a microscope. And they found that there was actually evidence of nerve damage that was not previously seen. So the challenge with concussion is it's more of a functional injury as opposed to an anatomical injury. An MRI per se or CAT scan usually will not show the damage. And after a number of brains were sectioned, this neuropathologist actually published the study, and that made news. And since that event in time, concussion has become kind of a sexy diagnosis. It's gotten a lot of media coverage, particularly in the athletic community for good reason. But also, we have to realize, too, that there are concussive episodes in non-athletic environments, work-related accidents, motor vehicle accidents, everyday activities of daily living. But so a concussion now in the last couple of years has gotten some tremendous research. And particularly the one seminar that really brought a number of specialists together was the Zurich International Concussion Conference a couple of years ago. And they had experts from around the world come together and first of all try to define what is a concussion. There's evidence that there's up to 42 actual working definitions of what a concussion is.
Really?
And about 2 years ago, the NCAA, which is the organization that oversees college athletics, got together and has teamed up with the Department of Defense. And they're actually looking at research, significant research with concussion. They've kind of come down and culled down a number of these diagnoses, or rather the concussion, into one definition. And essentially it's associated with either a single episode or multiple episodes of direct head, neck, or face trauma in which the brain actually becomes injured inside the skull. The injury is functional because frequently we can't actually see the injury on MRI or CAT scan, and it has a certain number of symptoms that we can talk about.
Right. Okay, let's talk a little bit about the mechanism of exactly what a concussion is. In past shows, we've had other doctors on here, and as we've explained with these other doctors, a concussion is when the brain actually hits the inside of the skull.
Correct.
Right? We kind of like explain it like it's a water balloon inside of a coconut.
Correct.
And if you shake that coconut, that water balloon is going to bang the inside of the coconut. Would that be pretty accurate?
Yeah, another way to put it would be look at a bowl of Jell-O. You have this solid glass that's holding the Jell-O, which is equivalent to the skull, and the Jell-O inside would be equivalent to the brain, and that's almost what a real brain consists of. It's pliable, it does move, but if you shake that bowl vigorously, you can actually create cracks in the Jell-O.
So again, a myth that a lot of the audience may have or the public may have is you actually have to have a head impact to cause a trauma. And we've explained in past shows that you could be hit in a rear end collision.
Correct.
Your head never hit anything, but your head moves so fast back and forth, the brain could be damaged inside the skull. Shaken baby syndrome, falls where people violently get thrown. It's funny you should say in that research study, or whatever you're talking about with the Department of Defense, I would assume that pilots who go through like tremendous G-forces or quick turns and stuff, they may be susceptible to this too, right?
The military has done a lot of research in head trauma, or is now known as traumatic brain injury. How the Department of Defense came to be is a lot of our vets are returning from Afghanistan and Iraq and have had no direct history of head trauma, but are having these concussive episodes from just the shock wave of these explosive devices that they're exposed to in the field. Actually, there have been a number of news reports on it. And they've actually now pooled their efforts with the NCAA, looking at a multi-center trial using the veterans coming back from overseas who have these concussive symptoms to do some proactive research.
Right. So just so the audience understands, it doesn't have to be head impact. The person can have some type of traumatic episode where the head moves back and forth. They can have a neck injury. They could have a face injury, which can cause the brain to bounce off the inside of the skull and cause a concussion, correct?
Correct. If you want to look at it, the brain is almost like a lollipop sitting on a stick, and that usually almost all whiplash mechanisms involve some type of a whiplash injury, whether you were hit from the lower back or you were cross-checked, and the head is whipped upon the neck, and then internally the brain actually is overstretched and will actually come into contact with the skull.
Let's talk about mom and dad who are going to go out this weekend and watch their sons play football, and all of a sudden the kid takes a good shot. What are some of the symptoms or things that either the coaches or the athletic trainers or someone should be looking at to maybe suspect that that child might have a concussion?
It's a great question. The challenge is right now, number one, is just having understanding that concussions can actually take hours to days to evolve. And that has to do with internal swelling of the brain. So by the time mom and dad is sitting on the sideline with a coach and you see a child getting hit or take a bad hit, The old sideline assessment of approaching the child and saying, what is your name, what's today's date, can you point to mom and dad, and obviously they don't have a concussion, and clear them to go back to play is a complete misnomer.
Really?
Yes, absolutely. The sideline assessments are very, very important, and they're not done frequently adequately, particularly when the municipalities, the private youth organization, a lot of municipalities, their referees and their coaches are not really trained appropriately. New York State does have a law in effect that all school-related activities, coaches, nurses, and teachers have to go through a concussive video to make them aware of the signs. So sideline, the largest issue is, first of all, you have to have an understanding that concussions evolve from hours to days. So when a child is hit, they should be removed from play immediately, and they should be evaluated by an educated sideline healthcare provider. That either could be an athletic trainer, it could be an EMT, it could be a coach that had certain training and awareness, and also then, you know, other healthcare providers.
Okay, so I'm a little confused. So your son's out in the field this weekend.
Right.
Takes a shot. They bring him off to the sideline. The athletic trainer, whoever's there, evaluates the child, says he's fine, go back in. If these symptoms take sometimes days or weeks or months to evolve, how do you know it's safe to put him back in?
That's the challenge right now, and some of the old sideline assessment tools that we've had in the past were not accurate enough. So they have a number of issues. The largest research is showing that actually the best way, there are a number of tests that have to be done to assess a concussion. But you know, number one, you have to follow emergency protocols. Make sure there's no spinal cord injury, no fracture, and the EMTs will usually do that. So if a child's left unconscious or on the field, you know, emergency protocols should be followed. You shouldn't remove that child unless their neck is stabilized. Once that's been achieved, you bring the child to the sideline, and actually research now shows us that of the wiring of the brain, almost 40% of the wiring involves eye movements. And that is controlled eye movements with the neck and with balance coordination. So the current evidence-based standard looks at, for example, a King-DeVick test, which is basically a ocular tracking test that is inexpensive, easy to do, and very accurate.
Ocular tracking, meaning you're watching their eyes following things, correct?
Correct, but the King-DeVick test can be ordered for under $40. It's a series of standardized cue cards that have numerics throughout the cue card, and the numerics are in not sequential order, so the child has to track those numbers, say them out loud, and you as the examiner have the actual answer sheet, and it has to be done in a timed fashion.
But that's not done on the field, though.
That can be done on the field.
Really?
Yes, and most athletic trainers who are appropriately trained, that would be one way to do that. The second best sideline test would be a BESS, B-E-S-S, Balance Error Scoring Test, which for the lay people would kind of look like a sobriety test, but it looks at balance and coordination. So these two tests alone should not be the end-all, but probably have the highest sensitivity in looking at an athlete that is concussed. And if there's any doubt, the child should be removed from play immediately and should sit out for the entire rest of the day. And you know, if the concussive symptoms are going to evolve over a day or two, which they can, the parent would know about that, which brings us to step two, is that parents have to have an awareness that concussive symptoms can occur a day or two later, and they have to be aware of what those symptoms are.
Let's talk about this. What should those parents be aware of? What should they look out for?
Well, they're variable. You know, initially, I think, you know, we have children of our own, and we were taught that, you know, if a child's concussed, never let your child go to sleep, always keep them awake. That was kind of old knowledge. Currently, the first thing you want to do is rule out any red flags, which are emergencies. And although it is rare, particularly with children and also with adults, if there is a violent head-neck injury, you can actually incur a bleed on the brain where the veins that actually and arteries that come off and feed the brain can actually be punctured or ripped, almost like overstretching a rubber band. That would then create a situation where there's a hematoma and there's a bleed on the brain, and that is absolutely an emergency situation.
What would that child be like when they take them off
Generally,
the field?
they have a loss of consciousness for a period of time, severe headaches. They'll usually tell you it's the worst headache they've ever had. There's often nausea and vomiting with it, and they're often frequently clutching their head. At that point, there's really no way to know other than bring the child to an ER.
That kid's right to the ER.
Right to the ER, and they should have a medical emergency room physician evaluate that patient or that child. Most likely will include some advanced imaging, particularly a CAT scan, to see if there's a bleed in the brain. However, I will also say that in such a case scenario, there may also be injury to the spinal cord or fracture to the spinal cord. So emergency protocols need to be maintained.
What other symptoms? Dizziness, altered vision?
Dizziness, altered vision, headache, confusion. The child actually, frequently the research shows that particularly in the older kids, and also now with sports getting competitive with younger children, almost 42 to 50% of the athletes actually hide their concussion because of either embarrassment or wanting to return to play. So they'll actually blow off the concussive symptoms. And also, I've seen on rare occasions children actually can be combative when they're being assessed, where they just absolutely want to deny that they're concussed. So dizziness, headache, confusion. They have that deer in the headlight look where their eyes are glazed. Poor balance, poor coordination are amongst the earliest ones. You know, later on, as the swelling in the brain develops, they'll also have cognitive issues, poor memory, difficulty sleep pattern, difficulty concentrating, personality, irritability.
So again, I'm the parent now. My kid takes a whack. They bring them off the field. Somebody assesses them. I feel like I want to run down there and just pull him off the field until he's assessed properly. Should parents do that? Should they just let the team people do that? Or what do parents actually, what should they do?
Well, I can tell you what's happened in our township of Smithtown. It's one of the first townships that's actually had paid EMTs at all home games for most of the town's sports. So I have actually spoken with the EMTs who are concussive aware. I have recently, with South Shore Neurologic, we've actually given a lay lecture to all lacrosse and football coaches pre-season on the signs and symptoms to look out for. And we have actually a link to a website where parents can actually look for their symptoms. So in other words, if a child is actually concussed on the sideline, it would be great if you had an EMT available to assess the child and then notify the parent that the child was hit and that a concussive episode has taken place, so the parent can actually look at a website, find out what the symptoms would be, and to file the child, you know, the next day or day after.
Got it. All right, let's move on to something else now. So we talked about you have to rule out post-traumatic brain bleeds. What age groups are most susceptible to concussions?
That's a great question. The research that is now looking at is brain development. We're looking at how these nerve endings actually mature. And these nerve endings actually have to grow and make specific connections so that we become, you know, well-educated, bright humans that can actually function. Between the age of newborns and about the age of 14 to 16 is where current science believes that these nerve endings are actually growing and making connections. So any point in that time from birth to 14, 15, 16, the brain is still maturing and growing, and children are more at risk for developing sequelae symptoms of a concussion and are a little bit more vulnerable.
My brain's still developing. No, okay. Still maturing for sure. And what about the elderly? Are they more susceptible to injury when they have a concussion?
Yeah, elderly have different issues when they have head traumas because as we age, and I hate to say this, but our brains actually statistically shrink a little bit. And so the brain actually pulls away from the skull a little bit, and that actually creates a little bit more tension on particularly the veins and also the arteries from the skull, so that if an elderly person were to have a modest head injury or neck injury, whiplash injury, slip and fall on the ice, or fall at home, hit their head on the countertop, that creates a little bit more torsion in that shear mechanism, and actually they're more susceptible to developing a bleed. And some of these bleeds can be small, so they often cannot show for a day or a few hours after the injury. So initially, grandma may get up and say, I feel fine, and then 4 or 5 hours later, they may start developing headache, nausea, neurological symptoms, and then that should also seek the advice of you know, a medical physician. Right. I would like to jump back and just you know, add one thought that just came to my head about the young children. The statistical facts also that children have pre-existing neurological issues are even more susceptible for having a worst case scenario of a concussion, and that would be family history of migraines. Children have AD, ADHD, dyslexia, Asperger's, seizure disorders, any other type of pre-existing neurological issue. If they were to have a concussive episode, statistics show that they take longer to heal and often have more sequelae.
And why is that? Is that because the neurological connections and development are already altered before they have that shock?
That's the current belief, yes.
And how much force does it take to get a concussion?
Great question.
Does anybody know?
We don't know. You know, we actually, society actually has ways of measuring, for example, alcohol toxicity. You know, and there's basic standard lines the police department use for toxic levels. We don't have that with concussion. We've been looking into that, actually. Some of the research has involved helmet telemetry, where they've actually have taken helmets and have put computer sensors inside the helmet that actually will send information to a laptop computer or your iPhone and can look at G-forces. So the challenge is, we've asked ourselves, at what G-force does nerve tissue actually get damaged? And we don't have an answer. And part of the issue is, you know, we're looking at the G-force of a 6-year-old versus a 9-year-old versus a 12-year-old versus an adult. And the brain has different, as the brain matures, it has different weights. Also in children, it is currently believed that their neck muscle development is not what a full adult would be. So a modest hit of an 18-year-old that does not produce a concussion in an 8-year-old certainly can produce a concussion.
And you see the 8-year-olds with the full gear and the helmets on taking
Correct.
shots every day out there.
Correct.
Is the equipment better now than it was for football?
Unfortunately, the bad news is that the current research coming out of the NCAA college research and the Department of Defense and various other laboratories have unfortunately not shown any link between helmets or any type of headgear guarding against concussion. That is kind of a myth, as well as mouthpieces. A lot of coaches say you have to keep your mouthpiece in, it guards against concussion. That has not been proven true. They even have mouthpieces with computer telemetry bite forces in the mouthpiece that also transmit bite force when a concussive.
Well, you know what, that makes a lot of sense, because I'm saying to myself, even if they have like totally shock absorbed helmets, it's not the head hitting the helmet that's causing the problem, it's the brain and the head that's causing the problem. So you can take that whole body and move it like this,
right,
and the helmet not move at all, but the brain's still bouncing off the inside of the skull, right?
As the analogy I gave you with the Jell-O, you have this glass bowl and you have the Jell-O on the inside. Even though the Jell-O is protected and you have a glass bowl, if you just shift that bowl vigorously enough, it will actually create cracks.
So why are all these teams and everybody spending all this extra money on these helmets, just to make it look good?
That was common sense belief, and I would agree that it would appear to be common sense that if you have a better helmet, it would guard against concussion, but the research has proven otherwise. So I would say that helmet technology does prevent the children and adults for facial fractures, external facial trauma, but is not shown to actually guard against the internal bruising of the brain.
I would think that, especially with like linemen or linebackers or tackles, that the collars they put around the tops of the shoulder pads that restrict the head from moving back and forth like a whiplash would do more than a better helmet, right?
I don't know if in particular is researched that. The initial cowboy collars or the cervical collars were designed to kind of protect from mainly spinal cord injury, with the head being whipped excessively back. So I can't comment if there was
I only say that because we know with whiplash injury that you can have concussive forces in the brain.
Absolutely.
Yeah. Okay, so what is second impact syndrome?
Second impact syndrome is still, we have a lot to learn about it, but essentially what it is in layman's terminology is a person has a concussed episode that is not diagnosed, or it may be diagnosed, and that person is allowed to return to play and they get hit a second time. Second impact syndrome has very lethal statistics. There's approximately 3 people in the United States that pass away a year from that, primarily unfortunately with football, although football often has a bad connotation because there are other sports that we can talk about that have a high incidence of concussion.
Hockey.
The NCAA is tracking concussions throughout college sanctioned sports. And so the top sports, not necessarily in ranking order, that have higher rates of concussion are football, girls and men's soccer, hockey, and lacrosse. It's interesting because I've asked the question, how about rugby? Or how about cheerleading? And the challenge is the NCAA does not track club sports. They only track statistics involving college sanctioned sports. So I think it would be fair to tell the public that any sport that has a higher likelihood of head contact is going to have a higher likelihood of concussion.
And as I understand it, it's not just like the same game second impact. It can be the next year second impact. It could be 3 years later another impact, where they're all cumulative in nature.
Concussions are cumulative, and they do add up, and eventually they can cause something known as chronic traumatic encephalopathy, which is a long-standing injury of the brain.
Right. So on our next show, we're going to talk more about like how they diagnose concussion, how they're treated, post-traumatic stress disorder, post-concussion syndrome. But for now, I'd like you just to let the audience know how they can contact you if they have any questions, if you have a website, if they want further information.
I can be reached at southshoreneurologic.com. We have 3 locations in Riverhead, Patchogue, and Islip. The office number is area code 631-727 3209, or I can be reached at rmangles@southshoreneurologic.com.
Thank you, Dr. Mangels.
Thank you very much,
Pleasure
Dr.
having you,
Dell.
and we'll
Likewise.
have you back on the next show.
Great.
For those of you in the audience, please understand that Dr. Mangels is an integral part of our team of specialists who work in all three of our offices, Melville, Ronkonkoma, and Hicksville, where on a daily basis we're in contact talking about the findings, exam findings of our patients that come in, so we can give you, the patient, the best care possible with our team of specialists working together. Thank you for watching. For those of you watching us on Madhouse TV, we'll be right back. For those of you watching us on Cablevision, we'll see you next time. And remember one thing, if what you're looking for is real wealth, join us next time on The Bridge to Health. If you're watching us on Madhouse TV, stand by. We'll be right back. If you're watching us on Cablevision, we'll see you next time.
Thanks for watching.
Finally, the time has come. You no longer have to choose between conventional medicine and alternative medicine. Today, unlike years past, your team of doctors from all disciplines are working together side by side for the benefit of you, the patient, to help you regain your health and cross the bridge.
Dusty Walker of the New York Jets, former All-Pro wide receiver. You're watching Bridge to Health at Madhousetv.com.
Finally, the time has come. You no longer have to choose between conventional medicine and alternative medicine. Today, unlike years past, your team of doctors from all disciplines are working together side by side for the benefit of you, the patient, to help you regain your health and cross the bridge.
Hi again. Welcome back to the Bridge to Health. And on our last episode, we had Dr. Ralph Mangels talking about concussion. But each week, we have a specialist in a different profession trying to educate you, the public, as to what each specialist is about and what they do and how they fit in with the team. Many of you out there go to one doctor, they tell you one thing. They go to another doctor, they tell you another thing. This doctor has certain results that the other doctor doesn't. That other doctor then institutes a treatment plan without knowing what the other results are. And not all the time, but a lot of times the communication isn't there. That should be there to give you the best diagnosis and the best treatment possible, which is definitely possible within our 3 centers of integrated healthcare where all the professionals talk together on a regular daily basis. That's the advantage we have. I mean, I can call up Dr. Mangels. By the way, welcome back, Dr. Mangels.
Good to see you.
I can call up Dr. Mangels at any time. He actually works in my office doing neurodiagnostic testing on our patients to see what types of nerve injuries they have. Or I can call him up if I have a patient that I suspect may have a concussion. We can talk about it. He's right there. A lot of times he could look at the patient with me. Much, much different than patients going all over the place and their team not talking to each other. So anyway, Dr. Mangels, welcome back.
Thank you.
Our last show, we talked about concussion. I just want to go over a few points again in this show for people who haven't caught the first show, just so they understand a little bit about concussion. Again, what is a concussion?
Concussion is a complex injury that is a functional injury to the brain. When I say functional, you cannot show any anatomical injury on imaging, X-ray, CAT scan, or MRI frequently. It does not show any. So it's actually an injury within the nerve endings and how the nerve endings travel. It's almost an overstretch shearing injury to the nerves, which are microscopic. So it's a functional injury that happens from either trauma or repetitive or one-time trauma to the torso that usually involves a whiplash injury to the head, neck, or face, and the brain internally has damage from that.
So a patient goes to an ER, they have a car accident, a kid has an injury in a football game. They're going to do the standard tests. They're going to do X-rays. They're going to maybe do CAT scans. They might do an MRI. Those all come back negative. And the doctor says to the mother, he has a concussion. He'll be fine in a few days. So there is no test in that ER that says that, yes, you have a concussion, other than the clinical exam the doctor's doing and his interpretation of, I guess, how the kid's reacting, right?
Not yet. If you'd like, we can talk about that, where the future of concussion is going. But as of now, the emergency room physician's goal is to make sure there's no life-threatening injuries or red flag or internal damage to the brain that is significant or urgent. That's their purpose. Once the child leaves or the adult leaves the emergency room, they're usually instructed to follow up with a healthcare provider on their own, and that's where the baton needs to be passed to another healthcare provider that has an educational awareness of potential concussion symptoms.
So many times, I wanted to ask you this question. Many times, children will be on these rides at like Great Adventure and these amusement parks, and the G-forces on those rides sometimes are nuts. And I'll watch these people on these roller coasters, and I'll see, as they're going around turns, I'll see their necks go, I'll see them go, and I've seen times when people actually come off those rides, honestly, where they say, oh, I feel sick, I feel nauseous, I don't feel good, I got a headache. Could they have gotten a concussion?
It's very possible they could have had a mild concussion. I mean, I'm not a roller coaster fan. I do watch my kids on the roller coasters, and now, you know, the industry is really pushing the laws of physics with rapid acceleration and doing loops, and so usually their brain and head are ergonomically designed in some type of restraint harness involving the head where there's not too much head movement, but I would agree with you, sometimes with these loops and the whips, it is possible for someone to have a concussion.
And as we said on the last show, it does not have to be a head impact. It's the movement, rapid movement of the head and the brain bouncing inside the skull
Correct.
that causes these concussion syndromes and microscopic injuries to the nerves in the brain, right?
Correct.
Okay. So now let's go back to things we did not cover on the last show.
Great.
Okay. What steps should someone take if they suspect they have a concussion?
The first one is just to have an awareness that the concussion does take hours to a day or two to evolve, maybe a little longer. So if we're dealing with a child in a sporting event, there needs to be a communication between the coach or coaches and the parent. And sometimes the parents may not even be on the field. Now having, people often have more than one child and they're pulled between two different directions. They may actually carpool with another parent who is actually at the soccer game or lacrosse game. So
Right.
the issue is the coach needs to notify the parent that there was an impact that may result in a concussion. That parent then needs to educate themselves on a website of what the symptoms are. If there's any concern, the parent should seek out a healthcare provider to look at that.
So again, for people who haven't watched the first show, the parent wasn't at their son's football game. The kid comes home, he's not feeling well, and he may have symptoms such as headache,
Nausea, vomiting, dizziness, loss of balance, loss of coordination. Personality changes may come a little bit later, difficulty sleeping, headache, difficulty performing multitasking issues, short-term memory, cognition issues.
right? And if the parent sees this and the kid was not removed from the game, go to the healthcare provider and have him checked out, right?
Absolutely. So for parents, probably the first portal entry would be a pediatrician. And having attended 2 of the recent tri-state area concussion symposiums at NYU, I have to say that it was a great symposium. It was sold out, but on occasion I actually sat next to a pediatrician, and on a following symposium I actually sat next to an orthopedic surgeon, and both independently actually shared with me that, wow, thank God that they actually came to the symposium, because what they were taught in their residency has evolved rapidly. So I would say that parents should take their child to a medical provider, pediatrician. We hope that the pediatrician or the other healthcare providers have kept up with the latest information on concussions and the evaluation of a concussion.
And again, the parents, if the kid comes home that day and he's fine, but 2, 3, 4 days later starts to develop these symptoms, they shouldn't just poo-poo it. They should understand that symptom from that game may take a few days to manifest, right?
Absolutely. There should also be a communication with the school, with the guidance counselor, and or the social worker or teacher, because a lot of times these children will have problems, particularly in vision. And as I mentioned in your last show, that research now shows that 40 to 50% of the wiring of the brain involves visual tracking, not just actually physically seeing, but tracking objects, like following a butterfly fly through the space. A child actually looks at notes on the whiteboard or now the smart board, and then very often will complain of visual tracking issues. Numbers, letters are jumping off the page, and they will get frustrated. A child may not know that's from a concussion. Teachers may see complications of that, so teachers need to be made aware of that. Child had a head injury, and that there is a possibility of a concussion.
That's a good question. So probably, I would imagine in most schools that the nursing staff has training and able to detect concussions, correct?
In New York State, as of, I believe, July of 2012, nurses, teachers, phys ed instructors, and athletic trainers do have to take a CDC-sponsored 20-minute video on concussive awareness. I think it's a great first step. I don't think it's enough. I've actually seen patients in our practice that went to the nurse after, 2 days after a football game, and it was just dismissed as a garden variety headache, and the child was told to take a over-the-counter pain medication, Advil Aleve, and have had significant problems thereafter because the concussive episode wasn't properly diagnosed.
So I think it'd probably be a good idea for someone like yourself or other healthcare providers who regularly teach about concussion, that these teachers and nurses should be taught more, right?
Absolutely.
Okay. So one of the things you talked about was ocular function. Is that an examination technique to diagnose concussions?
Well, it probably will be in the near future. The current research looking at brain development is actually looking at a number of issues. One of them is functional MRI, which is really on the cutting edge.
It's great stuff.
It's an MRI. It's a great stuff. It's an MRI that really doesn't show the anatomy. It shows these projections of how these nerves send signals. And so we can kind of get an inside glimpse of how the wiring is functioning. We now know that about 40 to 50% of the wiring of the brain directly and indirectly involves eye movement. We think of the eyes as just seeing, but actually we need to track things. We need to track a car through traffic. We need to track words across a page. And we're showing now that in concussive episodes that the earliest symptoms or objective findings can be seen in eye movement. The challenge is not everyone is trained for that. So you would have to either have special training for that, to look at that, and it can involve some sophisticated computerized testing, which, back to your first question about the emergency room, there are some physicians that are working on developing computerized testing in the emergency room that maybe in a couple of years from now, before you leave the emergency department, you may actually have your eyes checked to see if you have a concussion.
So that's awesome. But I think what's even more awesome, if I understand this correctly, is coming in the future with functional MRI, we're going to have a patient that we think might have a concussion go into an MRI tube, move their eyes in certain directions, and then the MRI scan will show if the nerves are firing correctly or incorrectly?
Well, the functional MRI will look at the projections of the brain, either with or without vision. It's a standalone test, and then the visual computerized test looking at the eyes is a separate standalone test. But both those two topics of investigation are showing that there's actually problems with how eyes track.
Gotcha. Okay. What type of healthcare providers should a parent or someone who's at a car accident who thinks that they may have a concussion, what kind of healthcare provider should that person go to?
It's important that the patient go through a medical portal first to make sure that there are no red flags. There's no bleeding on the brain, there's no fracture, and so that's up to the educated consumer, either your primary care physician, your pediatrician, orthopedist, or neurologist. And I've met all of the above that have advanced knowledge in concussion, and then from this last symposium that I attended, I also became aware, sitting next to a pediatrician and also an orthopedic surgeon from the Army, that they both shared with me that in their residency and their training, they never got this information. So I would say, hopefully your healthcare provider has kept up on the current evidence-based literature on what a concussion is.
So for those of you listening in the audience, this is the exact point that I'm trying to make about the advantages of a team approach. If your healthcare provider is educated in concussion and how to detect it and how to be aware and sensitive to the possibility that may exist, it can be an orthopedist, it could be a neurologist, it could be a primary care doctor, it could be a chiropractor, it could be anybody who does a thorough clinical examination with the proper training and proper experience. And what's important is not that it's treated by that doctor, but that it's recognized. Once it's recognized or is suspicious, your team leader who first assesses you will then refer you to either people within the practice or people such as Dr. Mengels outside the practice, so we can get the most important information from the members of our team jointly working together. What do you say, that's correct?
Absolutely, and if I can just expand a little bit, depending on, no concussion is exactly the same, and they've done research on, which part of the brain was bruised or injured. So if the parent or the child has more cognitive issues, they probably would see a neuropsychologist. If it was more of a balance issue, they would seek therapy with a vestibular therapist. If it was more of an ocular problem, a healthcare provider who specializes in eye movements and eye health would also be sought after. Chiropractor particularly comes into play primarily because of the neck component frequently involved with the whiplash type injury. And actually, the way Mother Nature has wired us, there is a tremendous amount of nerve endings that live in the upper 3 vertebrae of the neck, sometimes 4, as well as the surrounding muscles, that actually participate in these neck-eye movements known as the cervical ocular reflex, and also coordinate with balance. So frequently the patients that I see are the ones that have been through conventional medical treatment yet still have symptoms. And
concussion.
Absolutely. And often, particularly headache and poor eye tracking and the sense of spatial lack of awareness, dizziness, unsteadiness. And actually, very often, there's an underlying injury to the neck that has happened with the concussive episode, but that was never teased out. It was not diagnosed correctly.
That's awesome. So again, the advantage of having a team working together, you rule out the most critical and emergency situations first. You then rule out if there's any type of brain involvement, and if there isn't, we look for other things that might be causing those exact same symptoms, right?
Correct.
Because different conditions can have the same symptoms. You can have heartburn, or you can have a heart attack, and it can have the same symptom.
Correct.
We have to be able to have the team together to rule out what's what is there, what's not there, and then institute the best treatment given what we have.
Correct. And for your audience members, another thought just came to mind. It's very important, particularly for children. If your child was concussed, one of the major things you should do as a parent is immediately avoid any excessive physical contact and also stimulation to light, particularly computers or video games, because that has been shown to be very, very agitating to the brain early on. So that's an important issue that I did not mention, but that is noteworthy.
Right. So you don't want the child who may have concussive symptoms to go around and wrestle with his brother on the floor for a few days, because again, the brain might be causing more impact on the skull.
Correct.
Okay. How does a neuropsychologist come into play with concussion?
Both children or adults can have cognitive issues where, depending on where the wires were damaged, if it was to the frontal lobe or to an area that dealt with language or complex mathematics, these functions may be impaired. So a child or an adult may lose the ability to see words, they may lose the ability to perform sequential mathematics, and they may also have cognitive issues. Very often concussions that are not resolved on their own or not resolved with therapy fall into a chronic category and often involves depression, dysfunction in sleep, personality issues, mood issues, as well as cognition issues.
Well, we actually had a neuropsychologist on our show previously, and she actually treated one of my patients who had an initial car accident probably 7, 8 years ago, was diagnosed with post-concussion syndrome and post-traumatic stress disorder. She then had a subsequent accident, and that neuropsychologist's job, through a whole bunch of battery of tests that they administer to the patient, was to differentiate if there was any new injury from the second accident or if it was all from the first. And surprisingly, they're able to do that with their battery of tests, with the cognitive issues that the patient has, and let us know if this is new injury or old, which is, I think is pretty cool.
Pretty amazing.
Yeah. And how long does it take to recover from a concussion?
It's variable. I mean, for children now, if you remove the child from play or the adult, and generally average concussion should self-resolve within 7 to 14 days of rest is the current standard. If the symptoms go beyond 14 days or 3 weeks and they get progressively worse or they continue, they need to actually seek a healthcare provider, and then the ultimate healing time varies depending on the patient.
Again, I'm gonna come back again to the team approach because that's what I'm into. And I'm going to give an example of a patient we had referred to us by a neurologist, actually. This is a young boy, 17 years old, was injured in a football game, went through the whole battery of neurological tests, was diagnosed with concussion syndrome. And I mean, they had to take the kid out of school, severe headaches, opioids to control the pain, at-home tutoring, the whole bit, physical therapy. None of this stuff helped. So we did an exam on this patient, and we found that he had a first and second cervical vertebra were totally out of position or subluxated. And we started a chiropractic treatment plan on the upper part of the neck. Within 2 weeks, this kid's migraines resolved. Within 4 weeks, the kid was back in school. So again, like we said before, the neck symptoms can perfectly mimic concussive symptoms.
Correct.
And a lot of times, concussion is diagnosed as a diagnosis of exclusion, where they've ruled everything else out. And because they have these symptoms, we assume it's a concussion when it might not be, right?
They actually have a term for that, and it's actually a recognized term called cervicogenic vertigo is the actual medical code for that, in which problems with the neck, either the joints or the muscles, can actually induce this vertiginous or unstable motion. And they also, the second diagnosis that is respectable and understandable is cervicogenic headache. So those two categories are often where we see our patients still having injury and sequelae.
We also had a guest on here, Dr. David Weisberg, orthopedic surgeon, who talked about impact. And can you tell us a little bit about impact and what that is?
The impact is a computerized test that has commonly been used by most school districts now as kind of the standard for screening for concussive issues. It's commonly used, I believe, from junior high school and high school. Children have a baseline test done at the beginning of the year, and if they have a head injury, they are then removed from the field and tested again, and they look for a statistical difference. The interesting statistic is, at least from the experts that spoke at the NYU Langone seminar, was that in many districts, this is their primary source as a different or diagnosing if a child is concussed or not. But the current research is beginning to show that there is between 20 and 30, maybe even 40% of the children that take the impact test actually have a concussion and didn't pick it out. So the current understanding...
Whoa. Say that again.
That many of the concussions are actually not shown by the impact test. Some are, but some are not. It does not have a higher sensitivity as it once was thought.
Okay.
So it is a good screen, but many of the school districts use that as primarily their only tool
Oh,
to
okay.
screen the child and then tell the parent, you know, take your son or daughter to a specialist for further evaluation. But what happens in that child that passes the impact test that still has a concussion and it's missed? So what we're now learning, or at least the experts are saying, is that the impact test alone is not foolproof enough to find every concussion. It's a great screening tool.
Who determines when that concussion is resolved, when it's gone?
Whether it's a child athlete, high school athlete, collegiate athlete, or an adult, there is actually a return to play or return to life protocol that involves physical therapy and co-management with other healthcare providers. That's a time-based program. It usually involves some cardiovascular training, some balance training, depending on what that patient needs. Ultimately, when their symptoms abate, they should have an exit examination with the physician that diagnosed them with a concussion to make sure that their neurological function is back to baseline, back to normal.
And Impact could do that too, right?
They use the impact for that, but unfortunately impact doesn't look at all aspects of the brain, and this is why the specialists are starting to question if we're using that alone exclusively.
Right,
it doesn't really look at balance, it doesn't really look at eye coordination that well. It looks at cognition real well and a few other factors, but it doesn't cover all the bases.
Okay. What's going on as far as the future research in concussion? Is anything going on?
We mentioned in the first show, yeah, it was great news from the last concussive seminar at NYU is that the NCAA, which sanctions and looks over college sports, has actually teamed up with the Department of Defense. And the Department of Defense has had a lot of returning vets coming back with concussive issues. So functional MRI is on the forefront. Ocular movements is also on the forefront of looking at, can we detect concussives early enough? And even more interesting is that we're close, maybe a couple of years out, to actually have a blood test done.
Really?
So yeah, they're actually finding that when a head and a brain is actually jarred enough, there may be some proteins that actually spill loose and that become global throughout your circulation, almost like a heart attack.
Right,
There are certain enzymes that come out that you can find out in a blood test. So they're actually isolating these proteins now, and maybe within a couple of years you'll have a blood test in the emergency room or your doctor's office that will more definitively say, yes, based upon these proteins in your blood, you had a concussive episode.
Wow, wouldn't that be cool if, like, on the sidelines of a football game, you did a little finger prick test and they had a strip where you could tell?
Exactly.
That'd be pretty cool.
Exactly.
So the next question I have is, can concussions cause symptoms for 15, 20, 30 years or the rest of a person's life?
Theoretically, absolutely. Well, particularly with the NFL football players, and not to go back to that sport, but with the pathologist who's actually looked at the brains of deceased football players, we have hard evidence that there is significant damage to the brain. And for the lay person's audience, what these would look like, if you've never seen a picture, is if you would take a head of cauliflower and cut it in half, and you'd appreciate how white the inside of the cauliflower is. That's a normal brain. With these damaged brains, you're seeing brown spots throughout the brain. So there is long-term sequelae that they refer to as chronic traumatic encephalopathy.
When I think of long-term injury and long-term problems, the first thing that pops up in my mind a lot of times is Muhammad Ali. You look at Muhammad right now, he's a bare skeleton of what he used to be. He really can't talk that well. What does he have, Parkinson's?
I don't know him personally as a physician, but I think that's the understanding as a Parkinsonian type of dysfunction.
Has there been any research into concussion and brain injury causing Parkinson's or anything like that?
There's a strong link that researchers now, the Boston has a brain bank where people can donate their brain upon passing to cross-section their brain, but there is a link that they're looking between traumatic brain injury and dementia, traumatic brain injury and Parkinson's and Alzheimer's.
Right. Parent has a baby. Baby's 10 months old. Baby is learning how to walk, falls down, hits the head. Babies can't tell you they have a headache. Babies can't tell you, that they're hurting or they're dizzy. What things would you see in a baby that might have a concussion?
Children are pretty pliable, which is the great thing about a child, is that they're more elastic than we as adults are, so they're pretty forgiving. However, the biggest concern would be an internal bleed to the brain or such as trauma, and the best way to look at that would be to bring the baby to a pediatrician or emergency room, and they would look for some neurological signs that would clue the physician that there may be an internal damage.
And especially if the baby just doesn't stop crying, right?
Possibly, yes.
Okay. Dr. Mingles, I want to thank you once again for being on our show. And
me.
again, please tell the audience how to contact you if they have any questions or
can be
need more
reached
information.
at South Shore Neurologic. We have offices in Riverhead, Patchogue, and Islip. The phone number in Riverhead is 631-727-3209 is the office number. I can be reached on the internet or Mangels, M-A-N-G-E-L-S, at southshoreneurologic.com.
Thank you, Dr.
Thank you, my
Mendoza.
friend.
And for those of you in the audience, if you have any questions of me or any of our team, you can always contact us at any one of our offices. Thank you very much for watching our show. It was a blast. And remember one thing, if what you're looking for is real wealth, make sure you join us next time on The Bridge to Health. If you're watching us on Madhouse TV, stand by. We'll be right back. If you're watching us on Cablevision, we'll see you next time.
Thanks for watching.
Finally, the time has come. You no longer have to choose between conventional medicine and alternative medicine. Today, unlike years past, your team of doctors from all disciplines are working together side by side for the benefit of you, the patient, to help you regain your health and cross the bridge.